COVID-19 pandemic continues to grab our attention with an uptick in cases seen across the country and new variants being detected. We wanted to get you information that you need.
Western Mass News reporter Olivia Hickey now joins us live in studio after getting those answers on what we should know. Olivia.
Chris and Abby, looking at the state's latest COVID-19 data, there are now over 2,000 new COVID-19 cases as of last Thursday. And Hamden County alone saw 135 cases, the highest number of cases reported since the beginning of the summer. While people we spoke with today say they are taking caution, a local doctor reminds me that the pandemic comes in waves. The COVID-19 pandemic, 3 years after its first spread, continues to have an active presence, with causes once again climbing across the country. And with new variants like the BA.2.86 and EG.5 making themselves known.
I don't go to as many places that are having large groups of people anymore like before. So that's one thing that I'm doing different, and trying to just keep my distance from anybody that might be sick.
Springfield resident Michael Rodriguez tells Western Mass News he chooses to be on alert. We asked him if he has any concerns.
What may be helpful or what may be able to be done to better help us prevent from getting where we were a few years ago.
We brought this to Bay State infectious disease doctor Armando Paez for answers.
We have been in this pandemic for about 3 years now. There are different phases. We certainly have recovered from the very first phase of the pandemic, where we didn't have any population immunity or vaccines. However, what we know also is that the virus continues to evolve.
He explains the most predominant or circulating variants are from Omicron, and there are no ties or association with severe infection. But hospital COVID-19 data continues to be monitored. He reminds people that, like before, cases come in waves.
Last week, we had approximately 40 patients in the hospital that tested positive. Most of them, approximately 80% of them, really were not treated for COVID-19, meaning to say that they're probably here for other reasons other than COVID-19.
Dr. Paez notes there is always the chance of more severe infection for people with weak immune systems and the elderly who haven't been vaccinated or boosted. So we asked, how can people protect themselves?
Wearing a mask if you think in a situation or in a public outdoor indoor setting. If you're sick, stay at home, get tested. That's very important. And if you're at risk of severe infection and we got COVID-19, there's treatment available.
Western Mass News did reach out to the state's Department of Public Health for more information. They sent us a statement that reads, DPH continuously monitors COVID-19 activity and other respiratory infection metrics, many of which are reported publicly. While we are seeing increases in COVID-19 activity, including hospitalization, we have the tools to manage COVID-19 in Massachusetts, including vaccines, treatments, and tests, and the benefit of widespread immunity from vaccination and prior infection. Reporting live in studio, Olivia Hickey for Western Mass News.